vaccinating, or what happened to him? Seizure? Really? I have a shotgun at home with double wall buck if you'd rather use that.
The worst disease on earth, rabies. What you just witnessed was the deadliest disease on earth. Its name, rabies. Rabies is a viral disease that affects the nervous system of mammals, including humans. It is caused by the rabies virus, which belongs to the Lysovirus genus. The virus is typically transmitted through the saliva of infected animals, most commonly through bites or scratches. Once transmitted to you, your chance for survival is almost 0%, and that's not the worst part. The symptoms of rabies usually appear within 1 to 3 months after exposure to the virus, although they can manifest as soon as a week or even several years later. So you will realize you are infected when it is too late. The symptoms usually include fever, headache, and weakness. As the disease progresses, symptoms can escalate to hallucinations, paralysis, and eventually coma and death. But the worst effect of rabies would be hydrophobia. Your body will refuse to absorb water, leading to extreme dehydration and eventual death.
The patient exhibits agitated behavior when water is presented to him. He tries to escape when his mother presents a moistened cotton ball. He even bats her hand away because of his hydrophobia. He demonstrates some gagging and difficulty swallowing, notable at the end of this clip. Hydrophobia is a unique symptom of rabies and is used for diagnosis in developing countries with high rabies prevalence.
So what can you do to prevent rabies infection? First of all, vaccination is key. Vaccinating pets, such as dogs and cats, is crucial for preventing the spread of the disease to humans. In areas where rabies is endemic, pre-exposure vaccination may be recommended for individuals at high risk of exposure, such as veterinarians and animal control workers. But what if you are already infected? Once symptoms of rabies appear, the disease is almost always fatal. However, post-exposure prophylaxis can prevent the onset of symptoms if administered promptly after exposure to the virus. Post-exposure prophylaxis typically involves a series of rabies vaccine injections, along with rabies immune globulin for those at higher risk of contracting the virus. What can we do to control the impact of rabies? According to the World Health Organization, around 60,000 people die every year from the effects of rabies. To control rabies, efforts focus on vaccinating domestic animals, implementing surveillance programs to monitor the spread of the virus, and educating the public about the importance of vaccination and avoiding contact with potentially infected animals. Overall, rabies remains a serious and potentially deadly disease, but with proper prevention measures such as vaccination and prompt treatment after exposure, its impact can be significantly reduced. And maybe one day we might eradicate it.